So good evening. Good evening, and thank you for joining us tonight. I'm Pat Foran. I'm Vice President of Wellness and Quality with Northbridge Company. And the focus of this call today is on COVID booster vaccines. And we want this to be as collaborative a call as possible. We did have several of you who have sent us questions ahead of time. And so our panelists are happy to speak to those. And at the end of the call, if we have additional questions, you can put them in the chat. If we don't get to them, if you put your name, we'll be happy to have someone get back to you. So I'm going to just introduce the presenters tonight. We are very appreciative that we have some people from New England Community Medical Services. They're a collaborative practice of physicians and nurse practitioners who specialize in working in assisted living, long-term care, and subacute care. So they are very, very familiar with our environment. And they have actually helped us with some of our communities in Massachusetts and go as far up north as New Hampshire. So Dr. Soma is the managing partner of New England Community Medical Services, and Bethany Vrouhas is a nurse practitioner and assistant director of assisted living programs, and Chris Medros is nurse practitioner and director of clinical operations. I'm just going to go ahead and turn it over to you, and thank you so much for joining us tonight.
Thank you for having us. Like Pat said, we hope this can be collaborative. Certainly, we hope to address most of your questions throughout the presentation, but if we don't, feel free to put them in the chat box, like she said, and we'll follow up with them at the end. So our focus is going to be on the COVID vaccine booster for this presentation. And I'm going to, have Dr. Soma chime in here just briefly before we get started. I know there's still some hesitancy with the vaccine and the booster because of how quickly it was made. It rolled out about a year and a half ago. We did a lot of talks then to a lot of different communities, families, because they had the same concerns. It was developed quickly, but Dr. Soma will kind of briefly explain how it came to be so quickly and that, no steps were missed.
So just to share in, COVID vaccine, yes, there were a fair amount of concern how this came about within a year or so. Just to respond briefly, most of these vaccines were made based on mRNA technology, which is messenger RNA technology. So the messenger RNA technology has been in place for greater than 10 years or longer. And this has been studied and tested even with regular annual vaccines, flu vaccine, rabies, Zika, and many other forms of vaccines. So this is just to confirm and sort of reassure that. So this technology is not something that came about overnight. Since we had this in place, it made it much easier for the experts. Once they had the sequence of COVID-19 virus, they were able to pursue production of so-called spike proteins that simulate COVID-19 virus very quickly, and they're about producing these vaccines. In 10, 15 years ago, when we didn't have this technology, vaccines took 5, 6 or greater number of years. So this is how the vaccine were able to be delivered within a year and a half at this time during this pandemic. Go ahead. Bethany.
All right.
Go ahead.
I think she has a frozen screen.
I think so. Bethany, can you move?
Which, can you hear me?
No, we could not. You got it. Yeah.
Oh, sorry. I'll just start over. So there was common misconceptions when the vaccine first came out, and again, when the booster came about. One that we commonly hear is, I just had COVID, I don't need the booster. Everyone's going to get COVID eventually, which we certainly saw with the large numbers with Omicron. Why do I need the booster? And people who got the booster still got COVID. So we certainly do see breakthrough infections, but a theme that we want to carry through tonight through the presentation is people may still get COVID with the vaccine and the booster, but it does help prevent hospitalizations and severe disease. We do know that. It also does help prevent against other variants. There was a study that showed that people who had COVID and were not vaccinated were 2 times more likely to get COVID again than those who had COVID and were vaccinated. So again, we'll touch on this again through the presentation, but we still do recommend the booster if you've had a COVID infection and despite the breakthrough infections that we're seeing. Dr. Soma?
So just to differentiate, so we are in unique times at this moment, and what we call is a pandemic. This is a special time, calls for special actions. So pandemics don't happen in every few years. It's something that comes about once in 50 years, once in 100 years. So this is where the whole global effort comes into play, and to get a response that's adequate, and that we do not prolong this pandemic any longer than we need to. That's where vaccines and vaccine intervention is so important. And we were lucky enough, fortunate enough for our scientists to come up with this in a timely fashion. The fact that a significant number of people across the globe had taken the vaccine, it's going to continue to help turn this pandemic into an endemic environment. As I described, pandemic is something, infection that involves everyone globally. That's how we define pandemic, due to a new virus or new infection. Whereas endemic, at some point, we hope to be, is something that is localized in a localized environment, similar to flu breakouts and things like that. So we believe this COVID-19 will eventually become endemic in pockets of areas, and we would have a treatment option, as whether it's an annual vaccine or could it be once in 2 years. Those are to be determined down the road, I hope sooner than later. So we are hoping to be in better times in the near future. I just want to differentiate that, why this is a special time and calls for special actions. And also it's important that we all take responsibility individually to contribute and to collaborate so that we can overcome this real difficulty that globally we're experiencing. Thank you.
So I know some people are number people, so I just wanted to show you how Massachusetts and Connecticut were doing with their vaccination efforts. Certainly, if you've been on the DPH calls that happen frequently in Massachusetts, Dr. Madoff always says that Massachusetts is one of the leading states for vaccinations. So in Massachusetts, 94% of the state has received at least 1 dose. 76% has been fully vaccinated. And as of January 14th, 46% of the population of Massachusetts have received the booster. Connecticut, not far behind, 83% has received at least 1 dose, and then 74% has been fully vaccinated, and Connecticut's right there with Massachusetts with the booster efforts. So pretty astounding numbers. So I'm going to go through this and just to let you know some of the myths that are out there about the booster or the vaccine and the facts that follow them. So the first one is the ingredients in the vaccines are dangerous. The facts are that many of the ingredients in the vaccines are actually in our foods as well, such as fats, sugars, salts. Myth: the natural immunity I get from being sick with COVID-19 is better than the immunity I get from the vaccination. Certainly we've talked about getting COVID-19. You never know which person you're going to be. Are you going to be the one with the mild symptoms? Are you going to end up in the hospital? Are you going to have some other complications? We are seeing long-term effects of COVID-19 months later after infection. So the vaccination is a more dependable and safe way to build immunity than running the risk of getting COVID.
So vaccinations, just to add to that, but the antibodies produced by the vaccination are they're capable of giving you antibodies that can neutralize far greater than infections that you get. So you get immunity from getting infection as well, but the vaccine-related antibodies, vaccine-related immunity has greater efficacy in giving you protection that produces neutralizing antibodies and a longer protection than just getting an infection, and that could be a brief period of time. So the risk of you having another infection, it's far higher if you're not vaccinated, even after you're infected.
All right, myth: COVID vaccines cause variants. That is not true. They do not create or cause variants. They actually show protection against the variants. I'm going to combine the next two. The vaccine and the booster contain microchips, or they make you magnetic. So nothing is injected into you that would cause anybody to track you. It does not make you magnetic, not at the site that it was injected. Can it alter your DNA? Currently approved COVID-19 vaccines do not change or interact with your DNA in any way. And the last one, we hear it with the flu vaccine as well. A COVID-19 vaccine or booster can make you sick with COVID-19. There is no live virus in the COVID-19 vaccines. They cannot make you sick with COVID-19. They can give you side effects. I'm going to go over a few side effects that you can get from the booster, but we will also explain that the side effects are your body's immune response to the vaccine. It is not the actual virus.
Self-limiting.
So who is eligible for the booster? You can get the booster if you're 12 and above. All three, Pfizer, Moderna, and Johnson & Johnson, are on the market for the booster shot. You have to wait for a booster shot for 5 months if you received the Moderna or the Pfizer. You can get a booster if you received the Johnson & Johnson within 2 months. What booster shot should you get? Their CDC is saying that you can actually choose. If you got the first series of Pfizer, you can get your booster in Moderna, and vice versa. You can get the Johnson & Johnson. It's actually up to you which one you would like, or which one is being distributed at your local pharmacy. I am going to say here, Chris, Dr. Soma, and I are by no means professionals in obstetrics, but I'm sure we have people on the call today that are pregnant, trying to get pregnant, or breastfeeding. The American College of Gynecology and Obstetrics recommends the vaccine and the booster for all pregnant mothers. I would say that I would have you talk to your provider about where you are in your pregnancy or trying to get pregnant, and when is the best time for you to get the booster. But as of right now, they are recommending it for all pregnant women. So frequently asked questions: do booster shots use the same ingredients as the existing vaccine? The answer is yes. They have the same ingredients or formulation as the current vaccines that are on the market. The only difference is the Moderna booster is actually half the dose that people get in their primary series. What are the risks of getting the booster shot? So this is the side effects that we were talking about. Many adults and children do get side effects from, COVID vaccine. We also see side effects from other vaccines. This includes pain, redness at the swelling at the injection site, tired, feeling fatigue, body aches, headaches, fever, chills, nausea. Serious side effects have been documented, but are very rare. I know there was some questions about myocarditis, people perhaps getting myocarditis from the vaccine booster, and Dr. Soma is going to just touch on that briefly.
Yeah, so there are extremely rare side effects that have been documented, but it's in millions, 1 in million. So these side effects to be, with further studies and cardiology and other specialties have examined, it's very mild, self-limiting side effects. Yes, the words may matter, saying, yes, inflammation of the heart, inflammation of certain organs, but they are extremely mild and self-limiting and for the most part, yes.
Okay, I just had COVID. Can I get the booster? So the CDC recommends that as soon as you are symptom-free, or if you are asymptomatic, you have no symptoms and you are on isolation, as soon as the isolation is done, you can get the booster. There does not have to be any waiting period. A few more questions. Am I considered fully vaccinated without the booster? As of right now, the CDC says that if you had the primary series, the first and the second shot, you are what we call fully vaccinated. However, there's new terminology which has been released where they're calling it up to date, which means you have received both shots, or one if you got the Johnson & Johnson as your primary series, and then you got the additional booster. Is the booster free? Yes, absolutely. You don't even need to technically have an ID or insurance card in some places. I would suggest that you bring your vaccine card when you go to get your booster so that they can just add it to the little card that they handed out to when you got your primary series. It makes it easier. If I need a booster shot, does that mean the vaccines aren't working? I'm going to turn this over to Dr. Soma, but again, carrying our kind of theme, vaccines and the booster are working to prevent severe illness, hospitalization, and death. We have seen a reduced protection over time, which is causing us to need these boosters. And I know Dr. Soma wanted to add a little bit to that.
I know. So in general, there may be a question, why do we need boosters? So, obviously through this pandemic, we knew to begin with these mRNA vaccines are 90% of greater efficacy on initial administration. But as the time went on, we learned these immunities do wean down over time. So it has shown that it does drop below 20% or so after 5 to 6 months time. So that's when we found that people started getting infected or reinfected, even though you had vaccinations. It's clearly due to drop in immunity. So that's the reason for getting booster, to keep your immunity and antibody levels as high and the protection to be at 90% or greater. That's the whole idea behind this. And one may ask, I just saw a question saying, if I got a booster in October, do I need another booster? The issue is, our goal is to get through this pandemic, with less damage, less deaths, and then there will be a time we will determine, because the experts' understanding is the virus will get weaker and weaker as we move along this path, and even the variants likely to get weaker. We might get COVID, but we may not get COVID pneumonia and death. So when we get to that period, it may not be vaccine every 3 months or every 6 months. It may be, we may get to a point where we will include certain variants in one vaccine, and that may have to be administered either annually or every 2 years or every 5 years. That is yet to be determined. Right now, the most important thing is to get through pandemic. That's the key. So if someone asks me, am I going to need a vaccine 3 months from now, 4 months from now? I certainly want to tell you, most likely not, hopefully not. But if longer we hang in this pandemic, that may be the case, but we hope not. That's what I would say.
Okay. The last one is, can I get the flu vaccination at the same time as my COVID-19 booster? There was a lot of questions about that this fall and spring. I got a lot of calls about, can I get my pneumonia and my shingles and my booster and my flu? And the answer is yes, you can get them. Our recommendation, is just maybe 2 at a time on each arm in case you have a local reaction. You can kind of tell which one it came from, but certainly you can get them at the same time.
So the main importance behind this getting 2 vaccines or 3 vaccines together is that we want to be able to monitor any side effects, any interactions. And, you may have fever for COVID and you may not know, is it COVID vaccine or is it flu vaccine? So because of the safety protocols and to monitor the side effects, we recommend that we separate these vaccines so that we can address issues in a timely manner. So, it's nothing wrong in getting together, but separating them helps the providers and physicians to assist with any side effects, any concerns that comes out of a vaccine.
So how to find a booster. In Massachusetts, they have a VaxFinder tool at vaxfinder.mass.gov to help find your local pharmacies or whoever might be distributing them in your area. In Connecticut, it would be vaccines.gov. We also do understand that not everybody has access to the internet. So you can call 211 during the hours listed and follow the prompts to find booster clinics in your area. I do also want to say that if your communities are interested, at New England Community Medical Services, we have a partner pharmacy where we can bring booster clinics to the facility. We can do staff, we can do residents. So my email is up there as well if you want to jot that down, or you can get it from Pat, and I can certainly help arrange any clinics that you guys want to have.
That's great. Yeah.
So I know Dr. Soma feels very passionate about this one, about getting reliable sources. We just, we want to say, be careful where you get your information. You can see that most of my data and talking points today came from mass.gov or the CDC. Social media is, it's out there. It's Instagram, it's TikTok, and it's a lot of opinions, and you don't know what can be truth or not truth. So if you're, struggling with the decision to get the booster, make sure you're getting the information from reliable sources. Also, Dr. Soma mentioned this previously. We want to get back to a new normal. We don't know if you're going to need another booster. We don't know if it's going to be like the flu vaccine and be a yearly thing or be more spaced out. We just don't have the data yet. But it's so important, not only to protect yourself by getting the booster, but also, it's up to us to protect our families and our residents in our communities as well. And by getting the booster is a surefire way to do that. And that would be the end, and we will be open to any questions.
So behind the scenes, we have Jen Hastings and Shannon McGuire helping us. Jen or Shannon, do we have any questions?
So far, Dr. Soma answered the only question that we had live. So if there's any other, please feel free to write into the chat. Answer them.
And while
I
we're
think you may have covered so much ground.
You did cover a lot of ground, and we didn't speak directly to our Maine associates who may be on the call, or New Hampshire. We wanted to invite our Maine and New Hampshire associates in hopes that they will take away some really great information about booster doses. In our state of Massachusetts and Connecticut, our associates know this is mandated by the Department of Health, not by Northbridge. And so, it's an important that we do comply in a timely manner with the booster doses. And we have set up at each of our assisted living communities in Massachusetts and Connecticut, clinics, booster clinics specifically for our associates. And they are ongoing. And so we do thank you for your offer to help us. We may end up taking you up on that to get additional clinics set up. But in Maine, if anyone is on the call in Maine and New Hampshire that would like also to have a clinic set up at your community, we will do our best to accommodate that. So just either let us know in the chat or let us know via your executive director, and we're happy to help you make it easy to get booster doses.
Also, for any
Just a
communities,
couple
we are
of
happy
questions
to.
that came through at the end here.
Yes, go ahead, Jen.
So one is around if someone experienced myocarditis after the second dose, what is the probability of having a similar reaction after the booster?
So these are incidental findings, as far as studies that we have read, I have read, extremely. Well, first of all, let me just affirm that myocarditis is an extremely rare findings with vaccination, COVID vaccines, even after millions and millions of people have obtained. I mean, I'm not just talking about United States, even across the globe, in Europe and everywhere else. So we have not heard repeated episodes of myocarditis or inflammation. People have had suspected myocarditis, but it has always been, at least in my readings, always been self-limiting, did not require much in the way of intervention other than non-steroidals.
And what would you say, doctor, to people who may have had that side effect? What would your recommendation about getting the booster? What would it be?
So one, if you had with the second vaccine, I think our recommendations, what we do in my practice, is that they're usually referred to a cardiologist, and they usually examine with an echocardiogram. I have not come across one, but with the studies and recommendations published, and we will perform an echocardiogram and evaluate the heart function, and the recommendations follows after.
And what would you say to associates who may have had side effects that lasted, more than a day, maybe 2 days, that they personally thought were significant side effects? What would your recommendations be to them about the booster?
Most of the side effects that I've seen, I personally have taken care of. Directive nurses, I've given IV fluids, antibiotics, I've done a number of things, and they have gone on to take booster doses. So my experience is that these are related to vaccine and immune response to the vaccine. So it's fever, it chills, mild body aches, and sometimes people say, I felt wiped out for 48 hours. I mean, I'm describing their own words, and some don't experience that in the booster dose, and some never had experience in the first two, but they have had it with a booster. So, but one good thing I would tell you is that some of these symptoms do tell you that you are responding well, that you have a robust immune system. So it is a good reflection of it. And I will go on to say this, our residents and our loved ones at nursing facilities or geriatric patients, they get all these vaccines. We rarely see these symptoms of fever and chills and, mild and all this. The reason is that their immune system is rather muted. So this is what it tells in youngsters with robust immune system tend to see more more of these findings rather than a geriatric individual or loved ones in certain communities. They take the vaccine and move on as if nothing happened. But also to know, this is all the more important, that they should take the booster because the immunity can wean off rather quickly as well. So this is why we found how they got reinfected after 3 months or 4 months, because immunity had not been there long enough. So it is our immune system. It affirms you that you have a good immune system. Thank you. Very
good. Thank you. There's, I think, one last question here, and I often hear this myself. There's information regarding young women experience delays or problems with their menstrual cycle after the vaccination. Is this accurate information? Is there maybe a reason for this? Is it, fall under the category of self-limiting? And maybe
so I would, very good question, but I'm going to be, what I'm going to say is that I personally have not, because we have given, obviously I'm not in a GYN related environment, but we have, I've heard this, it's sort of hit and miss, whether this is real facts to this, we don't know. I would say each individual who have had such incidents or sort of experiences should take it case by case and really discuss in length regarding their findings and the history with primary care physician and GYN. Because if I were to sit here and blanketly to give an answer, I think I would be misleading to people. So it is important. It is extremely unlikely. It could be something incidental, and there had not been adequate data to support that. But at the same time, I would advise each case to be taken with its own merit individually and to taken up with the physician.
Okay, Jen, do you see any other questions?
I think that's all we have.
All right. Well, I will thank you very much for helping us with this panel. And I hope that those of you who are listening in have found this to be helpful. Please, if you, we will send around to the leadership team in each community this PowerPoint, and it is recorded. So we will send our recording around as well. Hopefully others will have an opportunity to listen. We know this is an unusual hour of the day to hold a WebEx. I don't think there's any real good time of the day to do that. So Bethany, Christine, and Dr. Soma, thank you so much for helping us out with this presentation. We truly appreciate it.
Thank you.
All right. Good night, everyone.
Thank
Good
you.
night. Thank you.
Good night.